Thank you for joining us in this presentation today. During this interview question, I want to thank you for allowing me to engage in this interview and address some tough questions that maybe you were asking about how I would handle or address some of the tough questions about. And one in particular was a delivery of care and how we would handle it in this particular institution. And I think, as we look backwards and we look in the past in this institution and how it was handled in the past about uh, farming out some of that care and delivery to other caregivers in the area, and some of those that would we'd have being able to have those people that have to take those um, inmates and people to handle those care, be able to have to be with them until that care was completed, um, and then have to bring them back, uh, and then all that time and consideration that was given to complete that care. As we look at the triangle, the care of the model of the cost, the scheduling model, we had to find a better solution to this. Um, and one of those things is, first we have to look at the minor issues in house. First, we had to look at the basic care level. We had to have some kind of infirmary in house that took care of those basic level care issues. And that had to come from both staff and a combination of that in civil service or contract medical care professionals in house. And that's with a medical team of medical team at each institution that manages the care day to day, day to day operations in house and just routine medical needs. And then we had to look at, what about those that needed outside more advanced things? And then we had to look at maybe putting something in place, maybe for more skilled advanced. So those skilled nursing facilities, which already some of those are in place. We have like the Frazier Health Center in Orient or the Franklin Medical Center located in Franklin County. Those are two excellent um, references for more intense medical treatments um, that could be utilized for some of those individuals, more serious individuals, instead of putting those in more costly places like hospitals and other places like that, where these disabilities may be more permanently, and these people may be assigned to one of these facilities during their incarceration, where they're more suited for these individuals, and especially another third specialized unit also in the Allen Oakwood Correctional Institute to treat those individuals with other things like dementia, so that we specialize in these certain areas, so that these people get the specialized treatment that they do need, um, instead of sending them out. So that we do look at the triangle model and how it relates to the cost as it relates to each of these individuals. These medical facilities do offer a cost-effective approach for these long-term health needs of these particular individuals, as we know that the health cost of overall for the state of Ohio has been increasing substantially since 2001, and particularly between 2001 and 2011, we've seen a doubling of the health care cost within that certain period in itself. And then with the efforts between 2011 and 2020, through the efforts of some of these particular uh, efforts of being able to focus in on these efforts of the triangle model and being able to focus in on those efforts, the costs have come down somewhat within those areas. So, we have to pay really close attention to that So I think that's where I see particular uh, cost saving factors coming in that. And and the third level of the medical care um, can come in through that partnership, which I see some value in, is through the Ohio State University Medical Center. Is where they have the emergency room and inpatient hospital services geared towards the surgery and some advanced diagnostic testing um, and so forth, where they have the specialized clinics at the Franklin Medical Center for these certain individuals, where they can schedule these clinics and so forth. Um, so, and then a fourth leg of that, and we've talked about this, and it's been implemented in one of my other um, uh, written papers, is telemedicine. That has gone a long way to being able to catch some of these through face to face through this teleport, catching these vital signs, being able face to face with these without even having to transport these people a long distance to be able to um, diagnose, treat, and on the spot where they are at the current time. So I think there's a lot of opportunities through this technology, um, um, which would decrease transportation costs um, statewide and be able to utilize all of these resources, including these medical centers, the High State University, um, and through telemedicine for those that don't need those advanced cares, but can utilize those special medicines on a telemedicine um, type platform. Uh, Another opportunity to reduce costs I see is number one is a copay. This will help curb rising costs as I see it, putting some of that back in to their uh, allowing those people to be able to make some of those copays uh, back in their pocket and coming out of their pocket. And another thing is making sure and signing up some of these people on things like Medicare insurance if they have that available, so that that can be a reimbursement type of platform, so that the state can be reimbursed for these, because those are definitely one that can reduce the overall cost for those. So, getting back to the initial thing, we're talking about, simply the delivery of care, expensive overall. And we know that. So, how can we reduce that overall delivery of care? You know, we've talked about, the model of the different individual platforms. We talked about the telehealth. We talked about the different types of medical care, such as the skilled nursing facility, the infirmary for the most basic type of care, and then the partnership that we could perform through things like OSU and those kind of things, and then the reimbursement functionality of those that we reimburse and reduce the overall costs for the state of Ohio through things like co-pays, Medicare payments, and those kind of functions. Because we know that um, reducing overall costs for the state of Ohio is one thing that is very important to the overall delivery of care and part of the functionality and importance of the triangle model of care, um, both for long-term and short-term overall functionality and um, reliability and functionality of the care of all of these people within this institution of care. Thank you and have a great day.